This is Nate Hudson with Ozark Radio News and News Team 7. Today I'm speaking with Josh Reeves, the Vice President of Development and Advocacy at Ozarks Healthcare. And
Morning,
Josh, good morning. You have a lot of hats. You do a lot for Ozarks Healthcare. Can you tell us about some of your roles?
Yeah, so kind of two primary roles that I have, and there's a lot of things that go with them. But on the development side, I run our Healthcare Systems Foundation. So all the charitable donations and activities around that are kind of my umbrella. And then on the advocacy side, I work a lot with state, federal government. I work a lot with our elected officials to make sure that rural healthcare in the Ozarks is protected and continues to flourish.
Now, speaking of advocacy, I hear you have some big news going on there. Can you tell us about it?
Yeah, so for the past 4 months, we've been working with our General Assembly members, State Senator Carla Esslinger and Representative David Evans, Judge Evans, I still call him Judge Evans. So on a couple of different things. One was insurance reform. We worked really, really hard to make sure that our patients get access to quality health care, and they were a big help there. But the big thing that they were able to do for us is $3 million in state funding through a grant to help complete 2 projects that we haven't started yet, but we'd like to start. And they were able to do that through an appropriations bill that the governor should sign any day. So what that is we have 2 federal grants that we received last year, one for $3 million from HRSA to work on the GI lab and some of the internal parts of the hospital, and then a grant from USDA to build a clinic in Mountain View, a new clinic in Mountain View. And we got those grants last year, but they weren't quite enough to be able to fund the entire 2 projects. So this $3 million extra money from the state will allow us to go in and start those projects and finish them. So.
One additional question I'd like to ask you is, you had said HRSA. I'm not familiar with that term. Could you explain that?
Health Resources Service Agency. So it's a part of the federal government that basically provides resources to primarily rural hospitals and the health organizations.
I'm certainly glad to hear that's
Yeah.
here. Now, moving on to your development role. Can you tell us a little bit more about how that works with the Healthcare Foundation?
Yeah, so the Ozarks Healthcare Foundation, its sole purpose is to support Ozarks Healthcare and Ozarks Healthcare mission. So when we have initiatives that are kind of community-based, it's usually the foundation's role to step in and kind of make those a reality. And the best example, and the most recent, is the mobile mammography unit. So this was something that the healthcare system has wanted for a while, and we knew that the public would get excited about it. So a couple of years ago, we kind of took that on through the foundation to start raising funds, and that was 100% funded by the community through charitable contributions. And it is, I don't know if you've seen it, but it is on the road. It's big, pink, and beautiful, and the communities are very excited about it. But that's kind of what the foundation does, is we take those special projects and we get the community engaged and we raise funds and we make them a reality. So.
Now, you had said the mobile mammography unit is currently on the road?
Yeah, so we're doing test patients right now, and I think within the next 30 to 45 days, it's going to start going out to our rural clinics.
Well, that is great to hear.
It is.
Now, when it comes to fundraising, I know last year you had a special auction that you held. Is there anything that's going to be going on the fundraising?
Yeah, I think that we'll do that again. So last year we had an auction specifically for scholarships, and we raised over $50,000 of the auction, and it was a combination of surplus items from Ozarks Healthcare, so all those closets that had old furniture in them, we emptied those out. But we also had a lot of community support. I think there were some folks that donated some cars and some four-wheelers, and we ended up with strange things, a giant propane tank that somebody had donated. All of it sells, and all of it raised money for scholarships. And I think that we're going to do that again this year, but we want it to be even bigger. So I would say to your viewers, you know, if you have an old car with a title, or if you have a boat with a title, anything that has a title that you don't need anymore, we will gladly pick it up from your place, pick it up out of the back 40, and we'll put it in our auction. So we're really looking forward to that. So those scholarships, they do two different things. One is we have community-based scholarships. So any graduating high school seniors from the community we serve, we gave out, I think, 14 scholarships this year. And there's also scholarships that go to help our own coworkers and their families with education. So it's very good. You know, we kind of grow our own in West Plains, especially with nurses and some of the other clinical staff. So the more help we can have to send local kids to our great educational institutions in West Plains, by the way, they don't have to leave West Plains. They can go to Missouri State, they can go to South Central. Those funds really help those kids get through their education.
I know with the foundation that volunteers really are the heart of it. They do a lot. So what kind of services does the foundation offer that volunteers?
You name it. I think that some people think that volunteers, you know, they have a kind of a small role inside the organization, but we have volunteers that do everything from greet people at the door. We have volunteers that work at our gift shops, at our thrift stores. We've had volunteers that work in departments like IT, if that was their specialty. But each year we have over 20,000 hours of volunteer service. So that's down a little bit. We had a couple of years during the pandemic where we didn't have volunteers in the hospital as much. We're trying to build that back up. So anybody, whether you want to volunteer for an hour or you want to volunteer for a full day, we'll take all comers, anybody that wants to volunteer. And you don't have to be, I get this question a lot, you don't have to be necessarily a people person if you want to volunteer. There's lots of things that go on behind the scenes that you can do. If you're recently retired and you have a management background or you have some kind of field of expertise, we would gladly take you.
Now, along with volunteering their time, if anyone is wanting to, you know, say donate to the foundation, how would they go about doing that? What is the steps that I would need to go through to?
It's really simple. We have a couple of different ways. You can go onto our website. So we have a Donate Now button on the Ozarks Healthcare website. It's right up at the top. Or you could call the foundation office and we could arrange everything. So 853-5200. And it doesn't just have to be monetary donations. We can take donations of stock, we can take donations of real estate, and obviously we can take donations of old junk cars if you have that too. So.
Well, Josh, is there anything else that you would like to tell us about things that are going on with Ozarks Healthcare right now?
You know, there is another project that we launched in January called Inside Track, and I want to talk, you know, we were talking about the scholarships. We started a workforce development program through the foundation. Healthcare, like a lot of other industries, has a very severe workforce shortage, and it's across the nation. We need to produce in the community more folks that go into healthcare to make sure that we can provide the services that we need. And what Inside Track does is it starts developing a career pathway for kids, sometimes as early as the 8th grade. So we have a career pathway coordinator, Sammy Radosevich, and she goes into middle schools and high schools and she meets with kids. This is actually great. In collaboration with South Central Missouri State, there's going to be a cohort of LPN nurses that start this fall that are in high school. So those students will be able to start in high school, they'll be able to get their education locally in West Plains, and when they graduate, they just have to do their clinical hours and they're a nurse. So we're super excited about that. And we want more kids to participate in that. So if you want to go onto our website, there's the Inside Track. If you have a young person that they really don't know what they want to do and they're getting ready to graduate, Sammy can come talk to them. She can show them the options. We have a lot of different career opportunities at Ozarks Healthcare. There's clinical opportunities, there's business management opportunities, there's support services. If you're a welder or a carpenter, we have a job for you, and if you're an accountant, we have a job for you. So I would encourage folks to get on the website and look at Inside Track and give Sammy a call if you know a youngster that may need a little bit of career advice. So.
All right. Well, Josh, thank you again so
Yeah,
much
thank you,
for
Nate.
coming in and speaking with us. This is Nate Hudson with Ozark Radio News and News Team 7.